in Mexico. And we are spending a certain amount to control the epidemic. And I just wanted to know if you thought that we were spending enough in the network of medical centers that we have in such a large territory. Thank you very much.
So that question was, you basically... Sorry, I'm just repeating the question for Dr. Ryan because he doesn't have the simultaneously translation. That question was about are we spending enough, or is enough being spent on the response, specifically for Mexico, I understand, Alejandro? And testing.
I think the question is, in a country with 146 million inhabitants, they are doing every day 40,000 tests. Will you consider this as enough number for a country of such a dimension? Excuse me.
Thank you. Sorry for that. But thank you for the clarification. We do get quite a lot of questions about how much testing is enough testing, and we receive a lot of questions specifically as you have phrased that. The answer to that is it really depends. It depends on the situation that is happening in terms of transmission. What WHO recommends for testing is to test suspect cases, and there are definitions for suspect cases. And in situations where testing capacity is limited, or there may not be enough tests, or where transmission may be incredibly intense, you may need to prioritize how much testing is being done. For me, what is a very helpful metric is looking at your percent positive. How many of those tests that are being done come back positive? And if that's a high number, then more testing may need to be done, because that means that you may be missing additional cases. So it's a hard question to answer specifically in the context that you have provided. But in many situations where testing is coming back, where you have 30%, 40%, 50% positive out of all of the tests that you've done, that means that you're missing a large number of cases. In other countries where they may not see as much intense transmission, or they're doing a large amount of testing, they're seeing a percent positive of 1%, 2%. That's what we would more like to see, but I don't want to put a specific cutoff, because it depends on the situation that you're in and the capacities that you have. But what is important is, without testing, we don't know where the virus is. And without testing, it's very difficult to put in place the public health measures that need to take place. With active case finding, we are detecting cases that are infected with the virus, that are potentially transmitting that virus to somebody else. We can carry out contact tracing, which is identifying all of the contacts around a confirmed case and putting them in quarantine, and so on and so on. So testing is a very important part of that strategy.
Could I just add, Margaret?
Yes, please do.
Yeah, no, just specifically on Mexico itself. Most certainly the scale of the pandemic and the epidemic in Mexico is underrepresented. The testing in Mexico has continued to be limited. Approximately, 3 tests per 100,000 people daily. If you compare that to somewhere like the US, which is over 150 tests per 100,000 people daily. Test positivity has remained very high, up near 50% at times. And that means many people are either been underdiagnosed or diagnosed late. And certainly this is having a differential impact in the country. There's a sharp difference in mortality between the wealthier districts and the poorer municipalities. And people who live in impoverished areas of Mexico are almost twice as likely to die from COVID, those who live in more affluent areas. It's also having a differential impact on the indigenous populations in Mexico, with the overall case fatality ratio is high, but amongst indigenous populations, the clinical case fatality ratio is almost 1 in 5, 1 in 4 to 1 in 4 to 1 in 5, and a large number of people from the indigenous communities reporting cases and deaths from COVID to date. So there's a complex situation in Mexico with this differential impact on the poor, on the indigenous populations, relatively low testing strategy, which means the scale of the epidemic in Mexico is clearly under-recognized, and therefore more could and probably needs to be done to really address the surveillance issues and also the differential outcomes for patients in different groups.
Thank you, Dr. Ryan, and thank you, Dr. Van Kerkhove. The next question will go to Grace from Health.